Good day everyone. Today is a very auspicious day because you know this is the Buddha Jayanti is today. Now today I will discuss about the folding of the embryo. I will show you the ectoderm, I will show you the mesoderm and I will show you the endoderm. In the endoderm there is no specification is there. So you will see only there is buccopharyngeal membrane and in the lower part there is the cloacal membrane. You see, up till now human being has no cavity within the body, that is the flat structure. Now what happened due to rapid growth of the embryo within the limited period, within the limited area, what will happen? There is formation of the fold. You see there is formation of the head fold of the embryo. So you see, due to the head fold of the embryo, our normal position is acquired. That means the buccopharyngeal membrane, which is situated on the cranial aspect, that goes to the ventral aspect and our mouth is formed. So you will see the head fold of the embryo, it pinch up some cavity which is situated below, that is known as the yolk sac cavity. So this is the yolk sac cavity which is situated below, and on the dorsal aspect there is another cavity that is known as the amniotic cavity, which contains amniotic fluid, a watery fluid. So you will see during the head fold of the embryo, you will look some portion of the yolk sac cavity is pinched up. So that portion of the cavity forms the foregut. Foregut means from here our mouth, the oral cavity, the esophagus, the pharynx, up stomach and the second part of the duodenum is developed up to the major duodenal papilla. Next there is formation of the tail fold. So you will see during the tail fold what will happen? The tail fold, it pinch up some of the yolk sac cavity and forms the hindgut. So which one is the hindgut? That means from which the descending colon, the sigmoid colon, the rectum, anal canal, all these develop. So gradually the yolk sac cavity becomes smaller and smaller, and next there is lateral fold of the embryo. You see, so all these folds, they meet in the point which is our umbilicus. That means by which we are connected with our mother in the earlier time. So this is the forming of the, it is the first human being when there is the cavity and that is looks like a chicken tidbit or Mughlai parota. Now gradually there is formation of the head, neck and all this thing. Now in this folding you will see, what you will see? When there is folding of the mesoderm, what will happen? There is the heart with pericardium, it goes towards the ventral aspect, our heart is here. And this part, the septum transversum, it goes in this region where you will see our diaphragm that separates our thorax from the abdomen. So this is the real position now. So this is how the folding of the embryo that produces lumen, and you see in this way, that means from second month to 4 months, that means the up to the actually 1 month to 2 months, that means the up to 8 weeks, all of the organs start forming. And in this time, if somebody takes any drug without the permission of the doctor, there may be the difficulty in the baby or there is formation of the monster. So thank you everyone for watching this video.